Hi everyone. For my advocacy project, I focused on medication errors and how to prevent them. In advocating for my patients, I decided to write a letter to hospital representatives regarding safe administration of medication. I led a team meeting talking about tools to prevent medical errors, and I created a brochure pointing out ways to reduce medication application errors. All healthcare professionals strive to provide the safest care possible. Sometimes, however, things can go wrong and harm can be done. Medication errors are preventable human errors and they are costly. Each year in the U.S., severe preventable medication errors occur in close to 4 million inpatient admissions and 3.3 million outpatient visits. A grossly inappropriate 7,000 patients die from preventable medication errors in the U.S. each year. Medication errors cost a total of $21 billion every year. In many cases, looking back at medication errors hardly goes beyond a comment that he or she may have been busy or distracted. Similarly, looking forward at past events does not raise more than, be careful next time. We need to look at how medication errors happen in the healthcare system. To do this, I focused on the Swiss cheese model by James Reason. According to this model, a series of barriers are in place to prevent hazards from causing harm to humans. However, each barrier, such as system alarms, administrative controls, surgeons, nurses, etc., has its unintended and random weaknesses or holes, just like Swiss cheese. The presence of holes in one of these slices does not normally lead to a bad outcome, but when by chance all holes are aligned, the hazard reaches the patient and causes harm. Apart from death from fatal medication errors, patients may suffer from short and long-term side effects ranging from mild nausea and vomiting to prolonged hospitalization or life-sustaining therapy. Furthermore, healthcare workers can suffer from shame, guilt, and self-doubt from medication incidents, and the hospital may face litigation from patients and family members for direct or indirect medical cost, for personal injury and mental distress. To borrow a quote from James Reason, we cannot change the human condition. We can change the conditions under which humans work. And that's exactly what I propose. This can include countless initiatives worldwide to minimize human and system errors. But ultimately, as nurses, it takes little effort to pause, think, and double check if everything is all right. So this project added to my clinical development by encouraging me to examine the role of the professional nurse related to effecting positive change within the U.S. healthcare system in order to provide evidence-based, safe, quality nursing care utilizing ethical principles. Ultimately, nurses are often the last line of defense in preventing these scary errors. Take the time to double check